The morning of your surgery, you will come to the Legacy building at Gundersen. You might have to come in for a surgery very early in the morning. It might even be dark out when you get up, so you can even come in your pajamas if you want to. You can't have anything to eat or drink the morning before surgery, so make sure to have a snack before bed. You will have to check in at the desk on first floor to tell them you are here for surgery. A staff member will take you to second floor after you check in. You will check in at the desk on second floor and someone will show you to your room where you will get ready for surgery. You will get some special pajamas to wear during your surgery. You will also get some slippers to wear. You can take the slippers home with you after surgery. You will stand on the scale to check your height and weight. The nurse will take your temperature in your armpit or under your tongue to make sure that you are healthy for surgery. You will get 2 bracelets to wear. The white one says your name on it, and the other one tells if you have any allergies. The nurse will put a pulse oximeter on your finger. A pulse oximeter is a little clip or sticker that shows the nurse how well you are breathing. A red light glows from it, and it does not hurt. Your doctor will come in before surgery to see if you have any questions. The anesthesiologist will come to see you. This is the doctor who helps get people to sleep for surgery. They will ask you and your parent or caregiver some questions. They may listen to your chest and have you open your mouth really wide. The child life specialist will come to see you before your surgery. They help teach kids what's going to happen and set a plan to make things as easy as possible for your surgery. Before your surgery, the nurse might give you some medicine to drink. This medicine can make you kind of sleepy and relaxed. Some kids even get a little silly. When they are ready, the people from the operating room will come to get you for your surgery. The child life specialist can go with you. Your parents will wait for you in the waiting room. When you go into the operating room, you will see big, white, bright lights above you. You will also get a nice warm blanket. You will have to move off your hospital bed and onto the operating table. They will put a pulse oximeter sticker on your finger. This will tell them how you are breathing during surgery. Some stickers will be placed on your chest and your sides so they can watch how your heart is beating during surgery. A blood pressure cuff will be placed on your arm. This gives your arm a tight hug and tells them how your heart is working. When everything is in place, it's time for your surgery. A soft, clear mask will be placed over your mouth and nose. Some special air will blow through this to help you get to sleep for surgery. Here are some things to know about going to sleep. The mask does not hurt, but it does smell a bit different. You will keep getting special medicines so you won't feel anything during your surgery. They give you just the right amount of medicine so you are comfortable and sleeping. When your surgery is done, you will stop getting that sleeping medicine, and that is when you will wake up. When the doctor is done, you will go to the recovery room. This is the name for the room where people wake up after surgery. There will be a funnel blowing some cool air in front of your face. Nurses in the recovery room will take care of you. They will take your temperature and you will still have that sticker on your finger. You might hear some beeping next to you, and that just tells the nurse how you're doing. You will also have an IV in your hand when you wake up. Most of the time, they put this in during surgery so you won't feel it. An IV is a small straw or tube that goes into a vein, the small blue lines in your hand. It is hooked up to a bag of special water. You will have this IV until you go home, and it can be used to give you medicines. It also gives you a big drink of water right through your hand. Once you are awake enough, the nurses will take you back to the room where you got started. Your parent or caregiver will meet you there. Before you go home, you have to be able to drink some water or juice. You can even have popsicles to eat. The nurse will want you to be awake and take a short walk before you go home. Your IV will be taken out, and you can get back into your clothes or pajamas. You will probably be tired for the rest of the day after surgery. When you get home, you should do quiet activities, like watch TV or play quiet games. After a few days, you will start to feel better. Some kids have to get an IV before surgery to help give them medicine and fluids or special water. An IV is a small straw or tube that goes into the veins, little blue lines, in your hand or arm. The nurse will wrap your hand up in a warm, wet towel and put it in a bag. This helps them find your veins easier because they puff up when they get warm. Next, the nurse will put a blue rubber band around your arm. It might be a little tight, but it will come off as soon as possible. This also helps her to see those veins better. Your hand will be cleaned with a special cleaner. It will feel cool and wet. You can talk with your nurse about options for numbing your skin before the IV. Next, the IV will be placed in your hand or arm. Since it is just like a little straw, you can bend and move your hand or arm once it's in its place, and it will move right with you. Some kids say they don't even feel the IV going in. Some kids say it feels like a pinch or like someone is pushing on their hand. The nurse will tape and wrap it up so it won't fall out. It shouldn't bother you once it's in place. If you get an IV before surgery, they can use special medicine through the IV to get you to sleep instead of having you breathe the special air.